Hi everybody, it's me, Anna. Kind of laying down here. I'm in a little bit of pain right now. I'll explain in a little bit, but today is June 13th, 2014. Today is my 3-year surgiversary from gastric bypass surgery. I cannot believe that it's been 3 years. And I will be 25 weeks pregnant tomorrow. I think the last video I did, I don't even remember how many weeks I was. Who knows? My videos are so far and few in between. I'm a hot mess. I have absolutely no makeup on. My hair is, I have no idea. It's been up in a ponytail all day. So yeah, I look a little crazy, but I don't even care. It's been a long day for me. But yep, 3 years from gastric bypass surgery today. Still very just like, wow, I can't believe that it's been 3 years. And of course I've gained weight because I am pregnant. I have gained, I want to say 33 pounds. My doctors aren't all that concerned with my weight gain because I have been on bed rest since, well, I'm on modified now, but I have no physical activity. I can't work out, I can't walk, I can't run, I can't do anything physical like that. I've been on pelvic rest, my poor husband, since January, and that will continue until after I have the baby, and even further after that. I have came across some complications with this pregnancy. I think I talked about having a subchorionic hemorrhage in the beginning. Well, since that, so much has happened since that. I have at 18 weeks, I believe, 18, 19, 20, 22, 23, 24, 25, yeah, like 18, 19 weeks, I had another bad bleed. And mind you, I had had a lot of bad bleeds before that. And they said, oh, it's just the subchorionic hemorrhage that you have going on. It should absorb itself, blah, 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 blah. And I remember at a 10-week scan, they said that my placenta was totally covering my cervix. But, you know, they're like, that should move. You have a lot of time. So at 18 weeks, they were really concerned because of the bleeding that I had had, or 18, 19 weeks, the bleeding that I had been having. And so they sent me over to a maternal fetal medicine doctor in Boston that day. They got me in that day. Went in, and they did a really long, extensive ultrasound that day. And they said that my placenta was still covering my cervix, and it did not look like it was going to move. And just the way that it was so vascular down there, and that I had what was called accreta, along with the complete placenta previa. So an accreta is when your placenta, an accreta is when your placenta starts embedding into your uterus. And there's 3 stages. There's accreta, increta, and percreta. Right now, mine is just the accreta. It's grown into my uterus. If it grows further into my uterus, it'll be an increta. And a percreta is when it has grown out into, outside of your uterus and has started attaching to other organs in your body. I guess I'm at an advantage because the maternal fetal medicine doctor, well, anyways, the first doctor, let me go back. The first maternal fetal medicine doctor that I went to completely scared the crap out of me. Talked more about the possibility of me dying. Was just completely scared, cried that whole week, wondering, because it is a life-threatening condition. It can be. So, I mean, that whole week I cried and cried, and, I'd hear my son talk or my daughter talk, and I would just bawl because it was like, I may not make it. Do I need to start writing letters to my kids? What do I do? So I ended up getting a second opinion. This lady rubbed me the wrong way. And my OB said, I have somebody that I want you to see. I'm going to have you have a second opinion with her. She is top notch in Boston at Brigham Women's Hospital, and she specializes in accretas. So I was like, thank God. So I got transferred to her, and Brady, stop it, please. I got transferred to her, and then I saw her, and she went over everything with me. There's my baby. And she was very... Brady, can you wait a second?
I want to see my Hot Wheels.
Okay, hold on a second, okay? So, she was very nice. You know, she told me that, yes, it is life-threatening, but she believes that I will be okay with this. And life-threatening means I can lose a lot of blood. I can end up in ICU. You know, you can go into cardiac arrest, you know, losing so much blood. I have to have a hysterectomy afterwards, which is fine because
Mom.
I did not want to have any more kids
Mom.
anyways. Hold on.
Mom,
What?
don't talk to yourself.
Brady, can I just finish this for a
Don't
minute?
talk to yourself.
So, but she was very, very positive about it, where the other, you know, lady was so doom and gloom and just scared the crap out of me. So, you know, the second doctor who I'm seeing now, because my care is now transferred to Boston, so I go to Boston for everything. My OB that's here that can't see me anymore because I'm too high risk. Plus, I'm dealing with antibodies that are in my blood right now.
Stop talking to yourself.
I'm not talking to myself. Hold on a second, okay? So, you know, I have this blood thing going on with these antibodies that are, you know, going through my blood and this placenta stuff going on. But because it has been caught early and there will be a plan, I'm at a better chance of surviving this, you know. But still, we all know that there's things that can happen, you know, during surgery. Because it's going to be a very intense surgery, you know. I'm due. Hold on, Brady. Please hold on a second. I'm officially not due. Sorry. Officially not due until... Okay, show him your cars. Okay, that's his Dodge Viper. Okay. I'm officially not due until the end of September, which is September 27th, but we have a plan right now of taking the baby the week of August 25th, unless anything happens before, which can possibly happen. If I have another bleed, I'll end up at Brigham and Women's Hospital and maybe have to possibly stay there until the baby is born. If I have more bleeds while I'm in the hospital, there's a possibility that they may have to take her early and she'll end up in NICU. So, yeah, my pregnancy, it's been complicated since day one. So, you know, I try to stay positive and, you know, think of all the good things, you know. I mean, that's all I can do. I mean, it's out of my hands. There's not much that I can do about the situation now. I am scared to death because of the surgery. As most of you know, the last surgery I had was the internal hernia surgery. And, what do you call it? And how difficult that was for me because my heart went all crazy and being told that I could have died from that, you know, internal hernia that I had, was very scary for me. And this even more so because this is just 100 times worse. But I've happened to be doing okay with this for some reason. I mean, I have my days where I just think and think, but, you know, I haven't had any panic attacks or anything like that. So just kind of hoping for the best.
Mom, stop talking to yourself.
My son thinks I'm talking to myself. I kind of am talking to myself, huh? But, can you please not suck on my arm? Oh, gross. But, so yeah, that's what's going on with me. Like I said, I'll be 25 weeks tomorrow. I have a belly. You can't see it. I'm laying down. It's been a rough day. I've ran around doing stuff that I probably shouldn't have. And
Mom.
now I'm in a little bit of pain that only feels good. I'm laying down. Yes, Brady?
Who are you talking to?
I'm talking to myself.
Don't.
Why can't I talk to myself?
Because it's against the law.
It's against the law, he says. So, anyway, stop it, please. And I'm having another one. Ah, excuse me. Okay, anyways, Brady, just stop for a second, please. Stop for a minute. This is turning out to be a disaster. So, anyways, that's what's going on with me. Let me get off here before he attacks me. And, you know, I'll try to update when I can. I have another doctor's appointment for Monday. 1 second. Brady Edward, this is enough. If you do not stop, we're going to go into timeout. That's enough. That's enough. Please stop. So, anyways, I have a big appointment on Monday. The last appointment that I had last week, they had found a Go right now. They found a small abnormality with her heart and some dilated bowel going on with her, but they don't think that it's anything of a big concern. So she has to have a fetal echo at Boston Children's Hospital on Monday. I have to have another ultrasound to check on her bowel and then a doctor's appointment. So I'll be spending most of my day in Boston on Monday morning. But I'll try to update everybody on that. You know, it's just so hard for me to do videos lately. I mean, this for one of them. You know, he's always up my butt or right by my side where I can't do anything. And so, Brady Edwards, please stop it.
I want to do so.
Oh, God. Wish me luck. So, yes, I'll try to document more, you know, when I get a chance. So, okay, I'm going to get off of here. So, hopefully you guys all have a good weekend and talk to you soon. Bye.